We are showing examples of good and bad communication in healthcare. This video is for training and educational purposes. It has been made with consumer involvement. Fictional scenarios have been used, with people acting as the individuals. Scenario 1. Sally is partially deaf. She is attending the appointment with her support worker, Claire. Sally is having difficulties hearing and understanding what the dentist is explaining at the end of her appointment. The next clip is an example of bad communication between the health professional, the patient, and her support worker.
Alright, thanks Sally. So we're all done for your appointment today. We just did a regular checkup and cleaning for you. And now it is important that you take care of your teeth and gums to avoid a buildup of plaque and bacteria. You need to brush your teeth at least twice a day with fluoride toothpaste and a soft bristled toothbrush. And use an antibacterial mouthwash every day. I know it's hard, but try to avoid too many sugary foods and drinks. Does that make sense?
Yeah.
Well, we tell you this every appointment. It's just your general oral hygiene routine, nothing new. So just make sure that you follow these instructions, yeah? I'll email the instructions to you as well, Jessica, so you can explain it to her later on. Now we need to organize an appointment date and time, for her next checkup. So I'll put her name down for general appointment 6 months from now. If she needs to change the booking, just call the contact center to reschedule. How does that sound, Jessica?
I'm not sure you should ask me.
Sally?
The next clip is an example of good communication between the health professional, the patient, and her support worker.
So I've checked your files. You prefer for me to talk slower and speak a bit louder and use some gestures and visuals as well. Is that correct?
That's correct.
Yeah. And then also, do you need an interpreter today?
I have my support worker here to help me if needed.
No worries. So I will make sure that I talk a bit slower for you to understand, and then for some time for Jessica to sign as well.
Sounds good.
So today we did a regular checkup and cleaning for you. And so today I saw a little bit of buildup on your gums. So we want to make sure that we're taking care of our teeth and our gums correctly. So you need to brush your teeth twice a day and make sure you floss correctly as well. So can you tell me what you must do?
I need to brush my teeth twice a day and make sure I floss correctly.
Yeah, that's right. So I want to see a healthy smile when I see you next. And for today, would you like to book in your appointment today?
Yeah, might as well.
So I recommend 6 months for your next appointment. Do you have a day that you prefer?
Fridays.
Fridays? Yeah. So we can do Fridays. Let me just show you my calendar. So I have Friday the 14th of February here. Does that week work for you?
Sounds good.
Yeah, easy. I'll book you in now.
Scenario 2. Sally has an intellectual disability. She is attending the appointment with her support worker, Claire. She is having difficulties understanding what the dentist is explaining at the start of the appointment. The next clip is an example of bad communication between the health professional, the patient, and her support worker.
Hi, I'm Claire and I'll be helping you today. So for today's appointment, we'll be cleaning the tartar and plaque underneath the gums. So this is basically to avoid the recurrence of dental infections and to avoid the deterioration of your oral health. Does that make sense?
I didn't quite get that.
Okay, listen to me very carefully. I clean teeth. Does that make sense?
Sure, I guess. But what about all those tools?
Don't worry about that. You'll be fine. So I'll just need to know a bit about her dental history, and then we can get started with the clean.
I have it right here.
Oh no, Jessica, do you have the?
I think I've got it on. I've got it written down here somewhere.
Okay, thank you.
The next clip is an example of good communication between the health professional, the patient, and her support worker.
Hi, I'm Claire. Nice to meet you both. What are your names?
I'm Jessica, and we're here for Sally's appointment today.
Nice to meet you both. So, Sally, I'm going to be working with you today. Just before we start, I want to know if there's anything that will help you talk better.
Oh, I have this book about it here.
I did have a look at this online, and I see that you talk with words, you communicate with words, and what I can do is use gestures and visuals to help you understand what I'm saying.
Yeah.
Is that correct?
Yeah, that's right.
Awesome. So I'm going to then use my notebook now to explain what we're going to do. So basically here we have a picture of teeth. And what happens is when we don't clean our teeth, there can be a buildup of bacteria. So basically that means that our teeth can get really, really dirty like this. And when they get dirty like this, we can get a bit sick. What do you think about that?
It's really interesting. Sally, what do you think?
Being sick isn't good.
Yeah, and I understand that. That's why we're going to have the clean today. So basically, we'll start the clean, and then after that, you'll see me in 6 months again for your next clean. And I'm going to be using these tools for your clean. So what do you think about that?
Good, I guess. But there's a lot of tools.
Yeah, and I understand that can be a little bit overwhelming, but when we're doing the clean, we're going to do it step by step where I show you each tool, and I will pause when you need me to. How does that sound? Good or bad?
That sounds good.
Awesome. And did you have any questions, Jessica?
None from me.
Awesome. Let's get started.